Welcome, viewers, to yet another episode of Conversations with Iyobusa. I remain your girl, Iyobusa. I'm happy to be here. So, on today's topic, or the guest I have on today's show is a doctor. He's a specialist. I'm going to be talking about pain. Pain, especially back pain. Okay, so let me put it in context. The physical body is a work of complexity and amazement, and oftentimes we take it for granted. That is, we just expect it to work into perpetuity. We just wake up every morning, jump out of bed, everything is fine and dandy, right? But somehow, and sometimes once or several times in our lives, we experience pain. Physical pain creeps in. And this is due to either physical injuries, bad habits that eventually catch up with us, or just by simply aging. Today's guest on the show is Dr. Oluseyi Fadayomi. He's a US board certified interventional pain specialist and anesthesiologist, whose special interest involves the treatment of pain using interventional and holistic approaches. He believes that promoting an active and healthy lifestyle will improve his patients' overall health and well-being. While there are different types of pain affecting the body, you name it, right? The different parts of the body, the head, the neck, back, shoulder, knees, leg. You can even start even singing that, head, shoulders, knees, and toes, but we're not going to do that. So while there are different types of pain affecting all the many parts of the body, on today's discussion, we'll be focusing on the back and the spine, and we'll talk about the common types of pain affecting the back and the spine, as well as some possible solutions. We are here for it. Dr. Fadayomi, welcome to the show, Conversations with Iyobusa. Really happy to have you here.
Thank you so much, Iyobusa. It's a pleasure to be here with you, and thank you for inviting me. And I'm looking forward to having a very educative conversation with you. As chronic pain is one of those things that we don't have enough information and knowledge about, so it'll be my pleasure to kind of help to chop it up.
Okay, doctor. So tell my viewers some way you give back to the community, because it's one thing, it's not about just, the work that you do, or there still has to be that element of, okay, what else do you do? How else do you give back, to the community, that, because that's also important. So talk to us about, give us one or two examples.
But what I'm most passionate about is, because I'm in America now, and I try to help Nigerians, like the diaspora, right? So we have a lot of, when I came in here, I had to go the long route. I had to go the difficult route, So when, as a foreign medical grad, I went to med school in Nigeria, coming to the States, it's not easy. It's very tough trying to get into the system here.
The system.
Residency, you have to go through so many hurdles, so many difficulties. And it's not enough to pass the exam, which is something you have to do.
Yeah.
But
go over and beyond. Extra stuff. Yeah.
Yeah, because you have to do better than the American grads for them to consider you. So you have to score high, but that's not enough. You have to do the groundwork. You have to network. When I came here, if I tell you the things I went through, it's like
I'm sure like mind blowing, right?
I used to walk with a folder in my hand with my resume printed, and I used to walk from hospital to hospital. In my area, in Boston, when I lived in Boston, in Maryland, I used to travel to Florida and Vegas, go to different hospitals, cold knocking on people's doors.
Say, hey,
I'm an undergraduate, I'm interested in this, I'm interested in that, just give me a chance. And the whole point is just to have a non-paid position. This is me begging for a non-paid position to observe, shadow, to be a research assistant for free. Even that was not difficult, so they can get a letter of recommendation, because here letters of recommendation are very important for someone to recommend you. Say, hey, this person can survive in our system. Yeah. So doing all that, I used to go to different communities, do different medical organizations, internal medicine, pediatrics, surgery. I used to go to all of them just to meet people, to give me a chance.
This is like hustling spirit, this is what you're talking about now,
Look,
this is the Nigerian, yeah.
Yeah, and over time, it took a minute. It took a couple of years to get the people to recognize you. I met some trailblazing Nigerians, in the process. Dr. Yele Aluko is one of them. I literally went to with this medical group, Association of Black Cardiologists.
Okay.
I registered for the conference, even though I was not a cardiologist.
Let's do, because you just want to,
was the keynote speaker. He was one of the first doctors to do what we call TAVR, transaortic valvular replacement, in the North Carolinas. He was the first doctor to do that. He's, was one of the leaders at Novant Healthcare over there, and he spoke. And, this is after 6 months of getting straight rebuttals, and no one wants to give me a time of day.
Yeah.
So I was just still pushing. He was having coffee. I'm going to talk to him like, hey, I'm a former graduate, give him my spiel. I give him my resume. I went to London. I did this. I did that. So wow, I'm impressed. Like, wow, you just walked up. Like, he was very impressed that I actually came up to him to ask for opportunities. So he told me to come over to North Carolina to come shadow him and watch what he did. And I flew there.
I think you're like, wait, what?
Yeah, it was crazy. And that just opened so many doors. That was the break I needed. It opened so many doors, so many influencer people, and there's so many other people that helped me along the way. So I'm passionate about this. So doctors that are coming from Nigeria, coming from other parts of Africa, the US, they don't know where they what to be doing. They don't know what they need to get, so I try to help them. So I've helped a lot of people in trying to place them in different places and give them advice, the best way to go ahead with your application. With my network, because now I kind of have a pretty decent network of professionals that are in good positions, that are program directors, assistant program directors, they're high up in there. So I can place, I'm like, hey, this is a person I know, he has this resume, look at him, get him an interview. So I'm very passionate about helping medical professionals in the diaspora, in helping them navigate the difficult course of
terrain. Yes.
And also having them place them into places where they're getting accepted into these programs. I have a lot of people send me success stories. Like I have one of my mentees now. She's doing a fellowship, I think Mayo Clinic now. And I remember when she started, she didn't know how to go about it. She wasn't getting interviews. I made some calls. He got in. So now it just to see the effort you've put in the past is showing fruition. So that's what I'm passionate about, helping foreign medical graduates and getting in different institutions. So I think that's is very important because it's a difficult journey.
That is, I love it because that's what you call paying it forward, right? So you got that help, fine, you hustled and all of that, right? Again, the African spirit and not the Nigerian spirit, and you got the breakthrough eventually, right? But then you're then taking a step back now, and you're like, you know what? If I can make this process a little easier for those who are coming now, behind my footsteps, sure, why not? And why not, right? Why not? Yeah, they don't have to necessarily go through all the things that you went through. No, absolutely. This is why you're acting as mentor. You have fellow doctors who are hopefully willing to act as mentors as well. It's laudable. Kudos. Thank you so much for this. Yeah, no, it's fantastic.
The first time I meet them, I'm like, hey, I want what I want you to take from that. Oh, thank you so much. I'm like, the thank you I want is for you to pay it forward to the next person coming after you, saying they need help. Like we have to look out for each other. We have to create this community. Like my program when I went to Chicago, I trained mostly Indian. And the way we work together and getting their people in,
it's phenomenal.
It's phenomenal. They will look after each other and make sure they're placed. And that's what I want us to do for each other. Look after your brother, it doesn't matter if from Gambia, from Namibia, we all want diaspora. We need to look after each other and help each other move to the next phase.
Okay, yeah, we're here for it. We are here for it, guys. Okay. So you have a very successful career here in the US as a fellowship trained, board certified interventional pain specialist. But let's take you back to humble beginnings. You actually started off in my hometown, Benin City, at the where you got your medical degree at the University of Benin Teaching Hospital, or what we call UBTH. Talk to us about it. So this one sweet my belly well. Again, I'm in Benin Bay. And when I saw that, I was like, are you serious? This guy, okay, we're here for it. So talk to us briefly about that. How did you go into UBTH? That whole experience, how did it shape you? Did you always want to be a doctor, and a pain doctor at that? Talk to us about it.
So yeah, shout out to Benin City. I have a lot of friends from obviously med school and living in Benin, because I moved to Benin at a very young age. I was 4 years old. We moved from Lagos.
Okay. So do you speak Benin? So do you speak the language?
I know the bad words.
I know. Okay. All right.
Yes. So we moved early on when I was 4. My dad was in the oil industry, so we moved to Benin early. So a lot of my friends call me the Yoruba Benin boy, because
the Yoruba Benin boy.
It's like we have the same mentality. We haven't grown up there. So UBTH is obviously holds a special place in my heart because that's where it all began. That's where I began my medical degree. But going back as a child, in being born in a Nigerian household, the expectations are real. It's either you're a doctor, lawyer, engineer, what have
So
you.
that's what I call the five professions, right? Doctor,
Yeah.
engineer, accountant, architect. What's the other one again now? Well, lawyer.
Yeah. So
Mm-hmm.
it is real. You don't have a choice. You're born into it like, okay, this is where we're at, All right, let's get it. So my dad was kind of fascinated about medicine. So he always used to say, like, medicine. But when I was, I think, my primary two, primary three, we had this career day where we had people come in to talk about their professions. And then there was this physician that came in, and like he was a doctor, and the way he was received and the way it was like a red carpet. And I was like,
You're
what
like,
is this guy? He
this
was
is
wearing his
celebrity.
white coat, like everything inside, doctor. I was like, wow, I like this. Okay. And then when he spoke, like it touched me. And this primary three is like fifth grade, right? In America.
Yeah.
I still remember it today because he was speaking of what he did and the gratification he got from just helping people, making a difference. Like not many profession you can have in this world where a direct impact on people's lives.
Mm-hmm.
And having been able to help somebody, make them feel better, heal their disease, give them, educate them, it was like I said, it's life-changing, and it stuck with me ever since. So that's how I pursued this line, this field. So I got into University of Benin. And you say, how did UBTH impact me? And it impacted me until today. And I think it all has to do with the Nigerian mentality and the Nigerian drive, because studying medicine in Africa, in Nigeria especially, is not easy. It's very difficult. It's very challenging. If you're not built for it, you can't survive, because the resources are not as available as it is here in the state. So you have to go the extra mile, get resources, get the information you need to study, and you have professors that make the exam. The harder the exam is, the more
it's like yes, exactly.
I guess. So bringing that mentality, because you find out that when you come to the States, you realize your level of knowledge and your advancement in the field is actually way above your peers here. Because when I started, and what I knew was at a level of way senior residents in my program. Right. And that's because when you start, you're with that Nigerian mentality, you hit the ground running. You're not waiting for anyone to give you pointers. You're going doing the research yourself, reading all the text beyond your level. So when you start working, they see how advanced you are, and that really helps you. So that has really helped propel me here in the States, being from Nigeria, having the mentality, having that grit, having that drive, having that focus, And yeah, so DBT has definitely left an indelible mark in my life, and it's helped me propel me to where I'm at today.
Holds a special place. It holds a special place in your life. It holds a special place in my life because it's in Benin City. It's just, and UBTH. I mean, I had aunties who were nurses, through UBTH. I have uncles who were like doctors, and I've always heard about UBTH, so we're here for it, we're here for it. So now let's talk about, Yoruba Benin boy, that's what they call you, the Yoruba Benin boy. Okay. So let's talk about the back and the spine now, right? Research shows that over 39% of adults have experienced pain or will experience back pain at some point in their lives. When I read that 39%, I was like, are you sure it's not more like 78%? Because it just seems like everyone that I've spoken to have experienced back pain. Just even in my sphere of influence or activity. Right. But we'll go with the research, this 39%. What are some of the causes, and why is it seeming so prevalent these days? Especially if I take a step back to just, like you and I were from Nigeria, Africa and all that. And like back in the day, how our forefathers did back-breaking work, like go to the farm and all of that. Now, I don't know if they experience back pain or now maybe, but it just seems like us, quote unquote, living softer lives, right? You're not going to the farm to like go and work or anything like that. But there's just this back pain thing now. So like, what's going on?
So, the incidence is still underreported, so back pain, to make it simplified a bit, is you can have this acute and chronic pain. So if we're going to restrict this discussion to back pain, you can, acute pain is, we describe it as pain between a few days to a few weeks or maybe months. So when it's going beyond the 3 month mark, getting to 6 months, and we've now categorized it as chronic low back pain. So speaking about the differences in Nigeria and the US here. So the culture is different. So I'm going to try to merge both, because culture is very important when it comes to pain and mentality of the environment you live in. That's why when you go to a different country as a doctor, you have to relearn medicine in that country. So
in that context,
exactly. Because in Nigeria, we are used to pain. We are used to that mentality of you will have experienced pain in your life, so it's not a big deal. So, and our forefathers did a lot of back-breaking work, so they definitely had back pain. They have hip pain. Like my dad, for example, it took my dad 10 years to tell me he had hip pain, like it's probably longer, it was not until it was getting bad. My mom was telling me like, hey, your dad has been having this hip pain. So I'm like, oh, why are you
like, I'll check you like,
that's what I do,
Yeah.
So as Africans, we have the mentality that we don't really want to tell people we have pain. We just live with it, know. In the US here, it's more like there is avenue to go get it treated. So you have people coming in. So but then you have to come to the US, you have to dissect that into populations, like the Black population as well, learn to live with it. They don't report it as early on as they should, which results in it getting them coming to you when it's far gone and it's really bad. So back to the question, is you have acute and low back pain. Chronic pain is when we say it's more than 3-6 months, and then which is part of my main specialty, I treat chronic pain. But I still treat acute pain, but mostly chronic pain, because that's what it is. Because acute pain, low back pain can come from like a back sprain, a muscle sprain, we call it myofascial, a little bit of musculoskeletal issues. And then you have, the chronic pain, the causes are multifactorial. So to kind of explain, to go into the nitty gritty, the cause of low back pain can stem from the spine. So you have a general term that we use in our world, we call it degenerative disc disease. So in the low back, that will be called lumbar degenerative disc disease. What that simply means is that our spine is made up of different building blocks called vertebrae.
Yeah.
So, and in between the vertebrae, you have the discs that are like made up of this gel type of tissue that separate the discs. And these are the building blocks of the spine, which act as a cushion, as a shock absorber for the spine. So as we grow older, this disc degenerate. It's part of the growth process, because
so it's just we can't help it. It's just inevitable.
Yeah, we can't help it. And as we grow older, this because physiologically, anatomically, the spine has a very poor blood supply to begin with. So they degenerate faster than other parts of our body. And if we're the kind of people that we stand for our jobs, we do heavy lifting for our jobs, that adds the environmental factors, because you have the genetic and you have the environmental factors. So people just have a bad anatomy, a bad genetic type, so they degenerate faster than others. But some people have external factors, the work, they're mailmen, they work in factories, they work in the farm, they do more laborious jobs, so they have more impact on the spine. So over time, this discs, they degenerate. And they start to lose water, they get dehydrated, and the more they degenerate, they lose their structure and their strength. So because of gravity, they start getting compressed. So the disc, when they degenerate, so they start to bulge out. And the space behind it is where the nerves are. So the bulging disc can cause, when you say you have a sciatica, it's that bulging disc that is irritating that nerve, and that sends the pain down.
Talk about that sciatica.
That disc is worn out, and then you have the joints in the spine called the joints that allow us to bend backwards and bend forward.
So the flex,
So they wear and tear, and that's what called the facet joints, and that develops arthritis. So you can have arthritis in your lower back, you can have bulging disc, you can have tears and weakness in your ligaments, and all that combined can cause one of the most common causes of chronic low back pain. And as we grow older, most of us develop these. So it's just a matter of how bad it is, what degree are you mild, moderate, or severe. So there are other causes of back pain in the spine, like the sacroiliac joint. There's so many joints in the back that can develop arthritis, can develop dysfunction, and those can cause low back pain. So just to give you a global picture, just to simplify, most common cause of low back pain can be muscular. It can be coming from the spine, which is called the joints in the back, and also the bulging disc as well can also be a source of the pain, and other joints around that area.
So, doctor, thanks for this. You mentioned there's one that holds a that's near, well, I don't say near and dear to my heart, but like that left an indelible mark on my body, and it is, I don't wish that on my worst enemy. As much as I hate my worst, even hopefully I don't have any worst enemies, but if I do, or if I did, I don't wish it was crippling, like crippling. So I'm an active person,
Right.
work out 6 days a week. I eat right and blah, blah, blah. But when that thing, okay, fine, I'm a CPA too, so I also work, I sit for long periods of time, working and all that. But when that sciatica hit, like it was humbling. I couldn't do even just basic go and brush your teeth was like a chore.
Very difficult.
Yes,
Yeah.
I could not. It's just there was a time where my sister was so concerned I could not get out of bed, right? And I'm like, oh my goodness, I never want to experience this level of pain ever again, right?
Okay.
So, with that in mind, what are some of the solutions or treatments to back pain? Bearing in mind that I know there's a spectrum of solutions based on, of course, the person, the physical activity, physical fitness, the age, and all these things. So talk to us about it.
Okay,
and by the way, I still have, it's not gone away. I don't think it will go away, but I manage it.
I was explaining before, the degenerative disc disease is the global term we use for most common cause of low back pain. So when this disc are bulging, they pinch on a nerve in the spine, and that's what sends that pain down your leg. That's what we call sciatica. So when a patient comes to me with this type of symptoms, the first thing we go for is conservative management. Okay. We see how long have you had this pain for. We have to separate between acute and low chronic pain, because we don't just want to start ordering imaging or MRI for everybody that comes out with low back pain. So do an examination, see type of pain, and if we elicit that this is coming from the spine, and once you're having sciatica, it means this, it could be coming from the spine, or it could actually be coming from a muscle in the buttock. Okay, so that's one thing that we have to differentiate when we see a patient with sciatic pain, because there's something called piriformis syndrome. Piriformis is a thin bit of muscle underneath the gluteal, that's the buttock muscles. It's like about 3 layers below it. It's a muscle where the sciatic nerve, which is a nerve that comes from the spine to the leg, go through that muscle, called a piriformis muscle, and sometimes that muscle can be in a state of tension. So that also can grab that sciatic nerve and cause pain to shoot down your leg. So a lot of patients experience pain when they sit or when they push on that muscle. They push on the muscle and they have this sharp pain going down their leg, then it could be from the piriformis muscle. There are ways to treat that. And then we won't coming from the spine, from the bulging disc, that can also cause pain shooting down the leg, different parts of your leg. So the first treatment, when a patient comes to me, is to try the conservative care, get them to do physical therapy. And, part of that is core strengthening, stabilization of the spine, providing core support, because that is very important. Because when your discs are weak, you want to help strengthen the muscles of the core to protect that spine. Also, things I discuss with my patients is, lifestyle. Are you a smoker? If you're a smoker, smokers are liable to have more degenerative disc disease, because that smoking causes constriction of your blood vessels, and the spine has one of the poorest blood supplies. So you're depriving an already deprived spine. So your disc will degenerate faster because they're not getting the nutrients they need. So also weight loss, that's also part of the thing, because the more weight you have, the more health risks you have. When I'm talking about all the systemic problem, hypertension, diabetes, we're also talking about weight on your joints, your knees, your back. So that will have all implications. So I would try to address this in a holistic way. In the first visit, see, if they're having mild symptoms, then yes, we discuss this conservative care, try therapy. We'll give them 6 to 8 weeks of physical therapy, change your lifestyle, try to work on weight loss, and then if they need pain medicine, then I prescribe them something. Sometimes I give them a week script of prednisone to help reduce the inflammation in your spine. Sometimes you might need neuropathic pain medicine, which is a nerve pain medicine they need. I know there is a big opioid epidemic in America. I don't know how it is in Nigeria. So this is a different conversation, which is a longer topic.
Right.
So in our field, we try to limit the use of opioids and try to figure out a better way to treat this problem. So if conservative care fails, done 6 to 8 weeks of physical therapy, they've done lifestyle changes, they've lost weight, and they're still having issues, then we can go ahead and start ordering imaging, get an X-ray of the lumbar spine or get an MRI. MRI is more advanced. That will tell me everything I need to know about how bad your back is and what it
so you're saying if PT cannot alleviate the pain, then there's something more. Is that what you're saying? Like,
yes.
Okay, then let's get to level 2. Okay.
So the thing is to because sometimes just conservative care is enough to alleviate your problems, your pain. But it also depends. If the patient comes to me and is having the worst pain ever, they can hardly walk, they can hardly move, they can hardly do anything, then I have to facilitate the process and skip a couple of steps, and we need to get imaging because they could, because sometimes there are ligaments in the spine that protect the disc. They could have a rupture in that ligament, and the disc could be popping out and be compressing the nerves. That's what an evaluation will tell me. So they have weakness in your legs, they have some concerning red flag symptoms, bowel incontinence or weakness in their legs, numbness around the groin area. They're not able to control the blood of their bowels. Those are red flag signs. I need to work quickly, probably send them to the emergency room to get an emergency CT or MRI because they may be having what we call caudal equina syndrome, which could be a dangerous issue. So it all depends on how the patient presents.
Yeah,
if it's like a patient that just comes and have back pain, goes down my leg, sometimes we can go along the process slowly to treat the problem, and then we go from stage 1, stage 2, stage 3 in the cascade of treatments. So we order imaging, get an MRI of the back, and that will tell me how bad their herniated disc is. If it's mild, moderate, or severe, I look at their joints in the spine, see if they have arthritis as well. So all that will inform me of the next stage of treatment. So what we do for interventional treatments for these is to, first of all, if they have a herniated disc causing sciatic pain, we call it radicular pain, but just for everyone to understand, we'll call it sciatic pain. We can give them epidural steroid injections. So I know everyone always scared about, oh my God, go into my spine with a needle. But this is very essential because some patients are not able to undergo physical therapy because of the pain, and I always describe this as a negative, like you're in a negative feedback loop right now because you're having low back pain, you're having so much pain, you cannot engage in physical therapy, you can't even walk, you can't do anything, and mobility worsens the issue. So you're on this negative loop where you can't work out, you can't straighten your core, and you're in pain, and it's just a cascade that's going downhill, and there's no effect. So I want to get you on the positive loop, which is get rid of the pain, which epidural steroid injection. Epidural steroid injection is an injection in the spine, which helps to reduce the inflammation inside the spine. It can actually help to reduce the bulge a bit, reduce the compression, and basically relieve the pressure of the nerve. So that's how the steroid works when we inject it in the epidural space in the spine. So reduce the inflammation, release the pressure, and this patient experience pain relief. So what that just does, it cannot engage more in physical therapy.
Got it.
And then some patients are so far along that they need back surgery. So we do a back surgery.
So back surgery is kind of like the last resort, like when Wow, no, thanks for breaking it down. And like I said, so like mine is still there. It's very manageable now, right? I'm doing things. I do my PT show. Okay, these exercises you kind of like need to be doing and all that. So I do all that, and it's very, very manageable. That period last year was just horrible. Oh my goodness. Okay, now you talked about a little bit just now about lifestyle, right? Lifestyle change. You take this holistic approach. Your lifestyle, activity. So talk to us about maybe my viewers why you advocate for a healthy and active lifestyle.
Right. So it's very important. Studies just coming out now. It was a research data done out of Houston, where it says people that start working out, adopting healthier lifestyles, eat better food, work out at least 2 or 3 times a week, do aerobic and non-aerobic isolation exercises, you can actually increase your lifespan by 20 years at age 40. If you do
This
this
year,
at 50, you increase it by 13 years. So these are research coming out that having a healthy lifestyle actually prolongs your lifespan, because we have to understand that what causes us to age is programmed into our cells. Or we have, the cells are programmed to be weaker as they multiply with time, because our
right.
bodies are in a constant state of multiplication and duplication. So we incorporating a healthy lifestyle feeds our cells the right nutrients, the right micronutrients, the right things to slow down that process. So that's why the first conversation I have with my patients is a healthy lifestyle. And
so you just have the conversation, like, okay, getting to know the patient, like, what do you do? How do you, right? Is that what you,
yeah.
just basic
First
question?
is getting a good history of the person's life and how their daily life is. Because I did a little bit of primary care in the UK. So I still, and in Nigeria, going to training, we have like a primary care mindset. We don't just stick to like a little niche specialty. I want to know your global picture. What are your health problems? Are you obese? Do you have hypertension? Are you diabetic? Are those controlled? Do you exercise? Do you walk? It's doing all this can help the global picture and also help the specific problem you're presenting with, because it's over years of not taking care of yourself that's led this down this path. So I like to have that conversation with my patients about like their lifestyle. Are you a smoker? Do you have any bad habits? Do you have good sleep hygiene, which is one of the things we don't talk about. Sleep is one of the most important things you can do for yourself, because your body needs that time to recover, to repair cells, to repair organs, to do that job, to help you rejuvenate. So
it's funny when you talk about sleep. So I once had Dr. Gloria Oyeni on my show to talk about mental health, right? And the number one threat to mental health, she said, was sleep. She was like, sleep deprivation, So I was like, well, what do you mean sleep? She goes, yeah, no, you also seriously sleep. So I asked her, I said, okay, how many hours of sleep are we talking about? Because some entrepreneurs will tell you, look, sleep is overrated, right? I only sleep 4 hours because I have blah, blah, blah. She goes, 4 hours is not it. She was like, at least like 8, 9. I was like, what's time to do 8 hours of sleep in this day and time? So what's your recommendation?
I will give you a simple, we call it expert opinion, which is a opinion based on my own experience. So I noticed because I have a busy surgery schedule, because I do a lot of simple injections, but I also do big surgeries like spinal fracture repairs, spinal cord implants. I have a whole gamut of the kind of cases I do. So it's a very fast pace and it's very busy. So sometimes I don't get to have enough sleep because I finish late, and then I gotta wake up earlier in the morning. So sometimes I get only 4 hours of sleep. And I've noticed whenever I have less sleep, I'm more irritable at work in the morning. My staff can tell, like, oh, Dr. Fadayomi, because I'm very short with this and that. But days that I get to sleep and get a full 8 hours of sleep, sometimes if I'm lucky, I feel so refreshed. I come in with a smile. I'm drinking coffee in the morning. I'm like, hi guys, how was your day? That already told you that sleep has a big impact on our mental health and also on our body, because your body needs that time to recover. But a lot of people, like successful people or who are really hustling in that grind, don't give themselves that time. They're not thinking about it, but it's doing a lot of damage. I tell my wife that during my period in residency, I feel like I aged 10 years more than I did.
Because my sister says it as well. Because my sister is a pediatrician. So she goes, residency, that thing was unreal. It's like sometimes you don't sleep in, is it 24, 48 hours? You just awake, you're like, that's not real, Yeah. Wow.
Yeah. So you can tell your body ages if you don't get enough sleep. So sleep is very underrated, and we need to talk about that.
So you're saying 8 hours, is that what you're saying?
8 hours is good. We don't always get it, but try your best to have. Also, be consistent with your sleep hygiene. Sleeping at specific times, also is very helpful, keeping your body in that rhythm, because some people can't sleep. They have problem initiating sleep, they have problems maintaining sleep. So that's also, another part of it. Some people have sleep apnea, also a big issue affecting sleep, so that's, there's a whole big gamut we can talk about.
So bottom line, what I hear you say is, so maintain an active lifestyle, eat right, and sleep well.
Yes.
Right. Okay. Because Dr. Oyeni told me, said, look, there's no health without mental health. It starts with the mental health and the physical health, right? But they're all interconnected.
Mm-hmm.
So now 2 doctors now telling me 8 hours. I don't know. I try to get between, if I can get 7, I think I'm good. At least I'm like, okay. And then like you're right. The days are maybe on the weekends, if I can sleep in a little bit more, but yeah.
Yeah, and listen to your body. Your body tells you, if you're tired, if you need to rest, just try to rest,
Just go and rest down.
Yeah.
Okay. Well, viewers, you're hearing, they're saying this second doctor again. And once you jump online and, research tells you, 7, 8, 9 hours of sleep to perform optimally. Try not to skim. You can skim sometimes when you can't help it, but don't make that a pattern or don't make that a habit, right? Okay. Guys, Dr. Fadayomi, there's no more to add to that. So I'm just going to thank you so much for taking the time to be on my show. The nuggets of information you provided, both about like pain management, back, we focus on back pain on this show, back pain, what are the causes, what are some possible solutions, just giving maybe your age, the type of person and all of that. And also advocating for like a healthy lifestyle. They're all invaluable. But I think the one key takeaway, and I'll address my viewers now. Viewers, the one key takeaway I take from this is, so there are 2 things. One is pain is inevitable, right? It's just like the doctor said, just as we age, the body just ages, right? So pain is inevitable. But 2, there are some ways we can help ourselves in either postponing that process or expanding the keeping pain at bay somewhat. So there's only so much you can do, but living an active and healthy lifestyle really, truly helps. That's 1. 2, paying it forward. Doctor talked about how he had to hustle, when he first moved to this country and all. First of all, the hustling spirit from back home, from my town or Benin City, do you understand? UBPH. And then he came to the US and had to hustle because it's not easy. It is not easy. But how now he's paying it forward because he had mentors then, eventually found mentors then who helped, guide him, coach him and all that. And now he is paying it forward and coaching and mentoring up and coming, diasporans. And that is very important. It's like paying it forward. And he tells his mentees, the thank you that I want is you also pay it forward, right? So we need to do that. We keep paying it forward, and that chain, we need to look out for ourselves in the diaspora. Doctor, thank you so much again for being here. We truly appreciate it. And you're going to come again because we only focus on back pain. There are like so many things, many things, But I think what I'll do is hopefully either maybe sometime next year or so where I'm able to get you guys here, a couple of doctors, we'll have a panel discussion and we'll talk about it.
Absolutely. I love it. Thank you for having me. I love this conversation. I think it's very important, especially to discuss with fellow brothers, in Nigeria and Africa, all over, to be, to be more, they say knowledge is power, right? So be more informed about our health. And I'm glad to be here to provide some insight into that. Thank you for having me.
Yes, thank you so much. So viewers, there you have it. Okay, so my own key takeaway, what I'm going to be doing is I try to sleep and doctor said sleep is key. I try to get 6 hours. I'm going to try and push you maybe 7, 8. But he says sleep is key. Do not deprive yourself of sleep. Affects your mental health and affects your physical health. They're all interconnected, all interrelated. Keep an active and healthy lifestyle, right? And then 3, pay it forward. Do something to pay it forward, help one another, lifting one another as we rise. So until the next episode of my show, if you've not subscribed, go and subscribe. Hit the subscribe button, like and share the goodness of Conversations with Oluseyi. Until the next time, I say you stay safe and have a super sparkly week. Bye now.